Hey everyone, I'm Dr. BBT and today we're going to talk about capsular contracture. One of the most common questions I get with long-term patients with breast implants is why do some people have firm, hard breasts after breast implant surgery? Well, it might be because of something called capsular contracture. In this video, we're going to talk about what capsular contracture is, why some people get it, and what are some ways to diagnose it, and what are the treatments for mild, moderate, and severe cases of capsular contracture. So what is capsular contracture? Anytime you have a foreign body placed in your body, whether it's a breast implant, a joint replacement, or even a pacemaker, your body has a natural reaction to form a thin layer of scar tissue around that implant or foreign body. When it comes to breast implants, your body will naturally create a thin layer of scar tissue around the entire implant in all directions, and that's called a capsule. Now, sometimes this capsule can be thick, it can be even painful in severe cases, and that is referred to as capsular contracture. In the more severe forms of capsular contracture, it can cause some malposition of the implant, and it can also distort the implant so that it looks very asymmetric and quite simply very just weird. How do you know if you have it? Well, it's not something that happens early on after surgery. It's one of those things that develops over the course of months or years. Why do some people get it? Some people get it because of a theory of what's called a biofilm theory. Biofilm is basically little tiny bacteria that just latch onto this thin capsule, and over time that increases the inflammation in the area, which then increases the thickness, and in most severe cases it can cause heavy calcifications, and if it's calcified, it's usually a little painful. So how do you know if you have it or not? Well, if you have one side that's a little bit more lifted or what looks like it's just tight and the other side looks soft, and then on physical examination when you palpate the area it's a little bit firm, and in most severe cases it's painful or tender to the touch, chances are you have something called capsular contracture. Are there any imaging modalities to help diagnose it? Well, yes and no. An ultrasound can be put over this and you can notice a thick layer of capsule or a thick calcification around the implant, and sometimes that can help diagnose. But typically this is a clinical diagnosis, which means based on the history and physical, you'll know pretty much if you have a capsular contracture or not. It can be on one side, it could be on both sides. If you have a history of capsular contracture in the past, you are more likely to develop capsular contracture in the future. So what are the different types of capsular contracture and how do you grade it? There is a Baker classification that helps us grade capsular contracture from 1, the most mild, to 4, the most severe. In Baker 1 capsular contracture, you have soft breasts that look soft and feel soft. That's normal. Anybody who has a breast implant will have a Baker 1 capsule that's normal. If you have normal appearing breasts, but on exam it's a little tight or firm, that's known as Baker 2. That's a very minor also, but it's a little bit more firm than a Baker 1. When we get to Baker class 3 and Baker class 4, that's now considered severe capsular contracture. For Baker class 3, not only do the breasts look distorted, but it's also by feel very distorted also. Now Baker 4 is when it's distorted by look and by feel and you have pain. That's the most severe. So what do you do for the different types of capsular contracture? Well, a Baker 1 is normal. You don't do anything for that. That's natural looking, natural feeling, no symptoms, breasts are soft. Everyone who has normal breast implants is a Baker 1. Baker 2, you might have some firmness on exam, but you won't have pain. You won't have too much distortion. When people look at the breast, it doesn't look like it's asymmetric, it doesn't look uneven, or it doesn't look misshapen. So there's really not much to do. However, sometimes it's a good idea to treat this before a Baker 2 becomes a Baker 3 or 4. So how do you treat mild capsular contracture? Well, it's an off-label medication. It's a leukotriene inhibitor. It's also known as montelukast. The trade name is singular. Yes, this is an asthma medication for people who need it to help with their asthma, whether mild or moderate, but studies have shown that this actually does help prevent the progression of capsular contracture. And this also helps patients who've had capsular contracture in the past prevent it from developing in the future, especially if they're having a surgery. Next is if you have severe capsular contracture. If your breasts are distorted from capsular contracture, or if you have pain, so Baker 3 or 4 respectively, then chances are you will be a candidate for a surgery. The surgery is to remove the capsule in its entirety and either replace the implants, or if you're looking for a lift or removing the implants with a lift, that's an option too. Now, there are certain studies that show that using an acellular dermal matrix, which is basically a foreign body or a cadaver donor, where you use a biologic material to help prevent that capsule from forming in a pathologic manner. Other studies have shown that meshes, so same mesh that you use for a hernia, can also be used to prevent the risk of capsular contracture. When you have a surgery, after surgery, typically Singulair or Montelukast is used to prevent the progression of capsular contracture in the future. Or another recommendation is to give antibiotics for a long period of time, and this is because of the biofilm theory. Another thing that's important during the time of surgery is to do the surgery at the utmost sterile technique, meaning using nipple shields over the nipples to prevent contamination from the nipple and areola, changing your gloves during the time when we put in the implants, using a specific implant funnel that helps put the implant in without it contaminating from the skin or the breast flora. We usually like to use an incision under the breast crease, which is the cleanest incision compared to around the areola or the armpit. And that also decreases the bacterial burden. And we know that by doing this, we decrease the risk of a biofilm. And the biofilm could be the culprit of this capsular contracture. What are some other causes of capsular contracture besides this biofilm theory? Well, if there's a little bit of blood that's left behind in the pocket, whether it's from a bleeding or a hematoma or even a seroma, that can also cause chronic inflammation. The chronic inflammation can in turn increase the thickness of that capsule, and in most severe cases can cause very thick, heavy calcifications in a severe capsular contracture. Patients who have breast implants for breast cancer often go radiation, and that will sometimes cause contracture of the skin. Sometimes this contracture can also cause a thickness of the capsule around the implant, further contributing to capsular contracture. Sometimes implant texture can play a role when it comes to capsular contracture. Textured implants are embedded within the surrounding tissue, which help prevent shearing, which then in turn prevents the increased risk of inflammation. However, that has been associated with a very rare type of cancer called breast implant-associated large cell lymphoma. Smooth implants, on the other hand, are not linked to that rare cancer. However, they do have a smaller increased risk of capsular contracture. Similarly, incision types can play a role in capsular contracture. Having an incision around the areola or in the armpit increases the risk of capsular contracture when compared to an incision underneath the breast crease, also known as the inframammary fold. The reason for that is if you're going through the areola, you are going to cut through the breast ducts and breast tissue, and therefore that contamination is still present. When you go through the armpit, there's sweat follicles and a lot of bacteria in that, and so that is a theoretical risk to go through the armpit. When you go underneath the breast crease and you're staying underneath the breast tissue and going under the muscle, that risk is reduced the most. And that's why the risk of capsular contracture is the lowest. So what do you do if you have capsular contracture and you had surgery to remove the capsules and you want to prevent capsular contracture in the future? Or if you just had breast implant surgery yourself, what are some things you could do to prevent it? Well, if you just had breast implant surgery for the first time, you may not need to do anything because the rate of capsular contracture is quite low. It depends on the study that you read. But if you never had it before, there's no need to preemptively treat it. However, if you do have a history of capsular contracture in the past and you have had surgery to correct it, you might be already on a medication called Singulair, which is an off-label asthma medication that's used to reduce the risk of capsular contracture. Other things that have been discussed but not necessarily proven is ultrasound therapy. Sometimes the ultrasound and the wavelengths can help break up the capsule and the inflammation that's surrounding the implant. However, no long-term or large study has done this to prove that it's effective against capsular contracture. Other things that were discussed were breast massages after surgery. However, there's not a lot of data supporting that. However, some plastic surgeons recommend massaging breasts after breast implant surgery. Some other frequently asked questions about capsular contracture is this a higher risk with saline implants or silicone implants? Well, saline implants have a silicone gel, so the outer part of the silicone or saline implants are basically made out of silicone. So silicone is still touching your tissues, even if the inside is saline. So the rates are about the same. When it comes to if the implant is placed above or below the muscle, there's a slight decrease of capsular contracture when the implant is placed underneath the muscle, and this is because there's less breast tissue that's touching the implant. When you go above the muscle, there's more of breast tissue that's touching the implant, which theoretically can increase the risk of biofilm and bacteria latching onto that capsule. The reason being is that there are some bacteria in breast tissue and breast duct, and so therefore the risk of capsular contracture is actually a little bit higher above the muscle. So in summary, a capsule is normal over any foreign body or any implant that's in your body, whether it's a breast implant, joint replacement, or anything else. The question is it a thick capsule that's causing problems? And if it is, that might be something called capsular contracture. If you're not sure if you have a normal capsule or a capsular contracture, please see a board certified plastic surgeon and they'll be able to help you out.